Welcome to the 960th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's proceedings with a silent prayer for 1 minute. Thank you. Today we have with us Dr. Shalini, BHMS. That's it, BHMS from Government Homeopathic Medical College, Bangalore. Work experience from October 2009 to November 2015. Medical duty doctor at Homeopathy Charity Clinic, Bangalore from 2015 till date. Homeopathy physician at Nisarga Clinic, Bangalore. Has done certificate courses in children health, CGH, then certificate course in gynecology and obstetrics, CGO, certificate course in skin and venereal disease, SBD from BIMD, Pune, Maharashtra. And the topic is homeopathy treatment for PCOD. So it is quite interesting that these young talented persons are not stopping with the postgraduate diploma or degree or graduation in postgraduate homeopathy, but they are still studying a lot of things, a lot of learning is there that will definitely make the presentation also different. On behalf of IFPH, I welcome Dr. Shalini. You can have a platform for next 40 minutes. It's all to you.
Hello, everyone. Yes. So thank you so much. And thank you so much for IFPH for giving me an opportunity to present a case today. So I'll be sharing the slides. Okay. Is it visible?
Yes, started.
Yeah, okay. Today I'll be speaking about homeopathic treatment for polycystic ovarian disease. Okay, and in our day-to-day homeopathic practice and daily, we'll be seeing one or the two patient or female patient who comes to our clinic and complains about irregular menses. So when any female patient comes to us and says that amenorrhea for 1 month or 2 months, then she'll be saying some other complaints like hair growth on her chin or hair fall, obesity. Then we have to take the case completely and we have to advise USG abdomen for that female patient. When scanning is done, then the impression in that will be like cyst in the ovaries. So first, we'll know what is polycystic ovarian disease. So it is the common hormonal imbalance which is seen in any female patient in the reproductive age, like when any female or any girl, her menarche may start at 11 years or 12 years, and her menopause maybe like 50 years or 48 years. And in this period of reproductive age, she may once in a while she would have gone for this polycystic ovarian syndrome or polycystic ovarian disease. So you can see the image here. On the left side of mine, you can see healthy ovary. Like in this image, you can see uterus, fallopian tube, vagina, cervix. On the left side of mine, you can see a healthy ovary. On the right side of mine, you can see ovary filled with multiple cysts in it. So you can see multiple immature follicles present in the ovary. When these follicles develop, in the ovary, the egg is not released. So when the egg is not released, the female patient complains with amenorrhea or menses doesn't take place in that month. So you can see here, the polycystic ovarian syndrome is the most common endocrinopathy in women in the reproductive age. It is a syndrome which consists of anovulation, means ovulation does not take place, and the male androgen hormone is increased in the body, which causes hair growth on the chin and more of acne on the face, chest, and back. You can see. It is thought to be a lifetime female hormonal imbalance where matured egg fails to expel from the ovary. So in a normal female the eggs will get expelled from the ovary. When the polycystic ovarian disease is there in that female patient, this matured eggs fails to expel from the ovary. Then she will be having irregular menses or amenorrhea or scanty menses. So, and this ovary is filled with immature follicles, multiple immature follicles, as we have seen in the diagram or in the image. So this PCOS affects 5 to 10% of all the ladies or the female patients in the reproductive age. So in every infertility clinic, we can see 50% of women who comes with infertility cases, and where the main diagnosis will be PCOS. So PCOS is seen in 50% of the women, and it can lead to miscarriages. And when the treatment is not taken, if for any female patient who ignores like irregular menses, when she ignores, it can lead to infertility where she cannot conceive child. Now we can see the difference between PCOD and PCOS. So we'll be having a confusion like what is PCOD and what is PCOS. So in the simple manner, when we can understand is that PCOS, that occurrence is rare and seen in lesser patients. And in our day-to-day homeopathic practice or clinical practice, we'll be seeing PCOD. There is a more common, that is the most common, which is seen in worldwide. And the definition of PCOS is it is an endocrinal disorder of ovaries with immature follicles. And that of PCOD is it is a metabolic disorder due to hormonal imbalance. So any patient who comes with PCOD, we have to take her in our confidence, and we have to tell her like PCOD means it's a hormonal imbalance and nothing, because they get panic like after seeing the scanning report, they get panic and like what has happened to me or any disease, like that type of questions they will be asking. So as a physician, we have to take that patient into consideration, and we have to take her in confidence, and we have to convince her that PCOD is a hormonal imbalance, and with correct proper treatment, it can be helpful in the treatment. So in PCOS, the presence of cysts or minimum number of cysts are present in the ovary, as while in PCOD, more than 10 cysts are present in each ovary. And the cause of PCOS is genetic, like hereditary, and the lifestyle and eating habits and mental health. And as the like what we can say is, as we are advancing in our lifestyle, in our career, and we are like as we are dependent on more of Western lifestyle, like we are dependent on like junk food and the sedentary lifestyle, and like for to go to any shop or nearby marts and all, we are using car, scooty, and we are not doing any daily activities like walking or like working in a MNC company. We are using lifts, staircase, and we are not using the steps or the staircase. So this kind of lifestyle, like junk food eating and sedentary lifestyle, this kind of hormonal imbalance is morely seen. And whereas in PCOD, genetic the causes may be genetics and insulin resistance, inflammation, and overweight. And the severity is see, when the female patient complains of PCOS, it cannot be reversed, while in the PCOD with proper medication it can be reversed. And like what we can advise as a physician is the diet control and the exercise and lifestyle changes and medications. And the complications of PCOS is infertility, like she cannot get pregnant, and risk of diabetes or hypertension. And the main complication of PCOS is endometrial cancer. And PCOD is with proper treatment and with proper diet and lifestyle, it can be cured. Next, we can see the causes of PCOS. See, as you can see in the image, the main cause is insulin resistance. And as I told before, wrong dietary choices and genetic tendency like hereditary will play a very important role, and fetal exposure to male hormone and hormonal imbalance and accumulation of toxins in the body. See, to know the cause of PCOS, first we need to know about the insulin resistance. Like, what is insulin resistance? Means when we have our food, it is converted into insulin production. When the cells in our body resist this insulin and the glucose stores in the body, like that leads to overweight, fat in the abdomen, and sudden overweight, and like lack of exercises and hereditary causes, and this can lead to hormonal imbalance. Uh, symptoms of symptoms of PCOS caused by the changes of hormones in the body. Like if any of family one is suffering with PCOS, sir, is it audible?
No problem. Please continue.
Okay. Symptoms of like polycystic ovarian syndrome, like caused by many changes in the hormones in the body. If in our family anyone is suffering from PCOS, irregular periods, and in that generation, like hereditary genetic and diabetes, it can affect, like from father side or mother side. Other possible contributing factors in the development of PCOS may include a low level of chronic inflammation in the body and fetal exposure to male hormones. So this is the causes of PCOS. Now we'll see the symptoms of PCOD. Like in our homeopathic practice or clinical practice, many female patient comes. The main symptoms of PCOD is the irregular or missing periods. She'll complain like this month amenorrhea, like I didn't get my periods, or last month I didn't get and this month I got. So irregular pattern of menstrual cycle is the main symptom of PCOD, and she complains of severe acne on the face, chest, back, and she feels fatigue, like weakness is there, and high male hormones levels, and skin discoloration is seen, and she complains of hair fall, hair thinning, and abnormal facial hair, and weight gain or obesity, and ovarian cyst, and mood swings like depression. So these are the main symptoms. So when any female patient comes with irregular menses, then USG abdomen is advanced, and based on the report, the further treatment is continued. Now I'll be sharing the case which I have seen in the October 6th last year. A female patient diagnosed with PCOD. She's 32 years old with irregular menses from 6 months. She's married and has 2 children, and she had these 2 children. Is it audible?
Please continue. It is quite natural. Somebody, some disturbance sound will happen. Don't worry. Yes, please.
Okay, thank you. Menses is delayed and comes every 2 or 3 months. So there is suppressed menses in that patient, and she has backache when the menses flow takes place, and there is leukorrhea or white discharge in the place of menses. So there is bleeding in spots per vagina. The bleeding is bright red, clotted, and painless, and burning and itching at vagina is present. She complains of burning and itching. So along with it, she has pain in the heels, and she has headache in the temple, in the region of temples, which is aggravated in the evening and ameliorated at pleasure. When she presses, her headache is relieved. When the detailed case taken, in the past history, she didn't have nothing significant, and on her family history, father also nothing significant noted, and mother has the same complaint. She has the same history of irregular and delayed menses. And when physical generals was taken, her appetite, hunger was normal, and the desire she for sleep and thirst, she drinks 18 glasses of water per day. On the examination of her oral, her tongue was dry, and stools and urine passage is normal. She sweats profusely all over the body, and the thermal cyst, she is a hot patient. And when the detailed case was taken, and I took her to my confidence, and when that friendly bonding was there, I recognized she was very and she has suspicious behavior there. And she's very religious, like always God, she's worshipping, she's going to temple, and the patient is very restless. I notice these symptoms, and she is uneasy and cannot bear tight clothes. So what I advise to every like practitioner is in one sitting we can't take all this. In the follow-up cases when they come, we have to observe and notice the symptoms, and we have to take her out to our confidence, and we have to tell the patient, like when she will be in the home and when she feels something unusual or characteristic symptoms, she has to write down. Because when she comes or when any patient comes, we can't make out, and even they can't remember the symptoms also sometimes. So we have to take the patient to our confidence, and we have to tell them, like when they are in home, like whatever they feel, like any characteristic pain or any characteristic pain or any characteristic mentals, they have to write down. And when they come and bring that slip, whatever they have written, it makes us easy to find the constitutional remedy. To find out the individual constitutional remedy, this method will help. So I advise this to everyone. And on the clinical examination, her height is 162 centimeters, weight is 72 kg. She's tall and obese, and her pulse rate is 70 per minute. Her BP is 130/80 mm of Hg. On systemic examination, her CNS respiratory symptoms, everything is normal. On taking the totality of symptoms like menses, when the case is taken, menses irregular, delayed, and there's profuse bleeding bright red, clotted, painless. These are the totality of symptoms. So suppressed menses due to fear of exam, as she was taking some online yoga exam and she had fear of that. Backache with menses flow, leukorrhea in places of menses, and vagina burning and itching is present, pain in heels, hot patient, built tall, obese person, and loquacity. That's what I noticed, and she desires to be in company. So respiration, after analysis and evolution of symptoms, repertorization, and consultation of materia medica, many materia medica, the remedy which was selected was lachesis. The medicine prescribed was lachesis 200, one dose stat, followed by placebo, which is for 15 days. Menses started within 5 days. See, when the case perfectly suits the remedy, the result is seen very soon. So we have to find out the correct individual constitutional remedy. So we have to mainly concentrate on the characteristic symptoms. So menses started within 5 days, patient felt better, and again placebo repeated for 30 days. After that, no complaints at all. She felt better. So what we can conclude is, as the PCOS is a multifaceted problem with reproductive, endocrine, and metabolic dysfunction, the lifestyle modification and counseling is considered to be the first line of treatment. We have to do counseling to them, which is effective in reducing the signs and symptoms of PCOS. Cases can be treated successfully by homeopathic treatment. For this, we should consider the constitutional mental generals for the selection of the most homeopathic appropriate remedy. So this is the case which I have treated, and now I'll be Next is the special diet is also very important part of PCOS. Some women with PCOS find success by reducing the total intake of carbohydrate like cereals, breads, pastas, and choosing to eat different types of carbohydrates that are less processed like whole wheat, brown rice, beans, replacing manufactured carbohydrate products with whole grains. Fruits and vegetables can help to reduce insulin response. The diet also should include enough protein to control the amount of sugar in the blood. Exercise is very important to help maintain the insulin level. In above mentioned case, her menstrual irregularity and other associated symptoms became normal with the cases in just 2 months. This shows how effective homeopathy is in treating such lifestyle disorders in a very short time. So homeopathy treatment is based on the symptoms, as I have already told. Similarity, totality of symptoms. For selection of remedy, a detailed international journal of homeopathy science case taking is very necessary. For this, the repertoire is also very useful. So this is the case which I have treated in my clinical practice. So I'll be sharing you with some other remedies, homeopathic remedies, which help in the curing of PCOD. The first one is Apis mellifica. As we all know, the common name of Apis mellifica is the honeybee. The patient who benefit from this remedy have some of the following signs and symptoms like inflammation of ovary with severe pain, especially in the right ovary, and there is a tumor in the ovaries, irregular menses is seen, and there is suppressed menses. Along with this, the patient complains with vertigo and feeling of tiredness in the brain, in arms and legs, back pain. Swelling in the genitals in females is seen, with usually subsides or ameliorates with cold water. Heaviness and pain in the abdomen is seen, and there is pain in the region of uterus and abdomen. And she likes spending time in open air and bathing in cold water, like cold water ameliorates her complaints, can be useful in the management of these symptoms. And the mental genres for this Apis mellifica is apathy, means indifference, and unconscious state is seen, and awkward and drops things readily, and stupor is seen in the patient with sudden sharp cries and starting stupor alternating with erratic mania is seen in the Apis mellifica, and sensation of dying, and she feels listless and cannot think clearly, and jealousy is seen, and fidgety, hard to please, sudden shrill, and whining is seen. Jealousy, fright, rage is the main important complaint, and grief, and she cannot concentrate mind when attempting to read or study. So when these kind of symptoms is seen, and proper case taking and proper repetization, Apis mellifica will help. And the next remedy which I'll be discussing is natramur. As natramur is a very wonderful remedy, and its common name is chloride of sodium. The symptoms are this remedy is mainly useful in individuals with great weakness. Weakness is seen main, and weariness with most of the weakness felt in the morning. In the bit, like when the patient gets up in the morning, that weakness is seen. Individuals for whom this remedy is beneficial have some of the following symptoms, like the patient complains of irregular periods with usually profuse bleeding is seen, white watery discharge, and vagina dryness is there, and pain in the abdomen region, which worsens in the morning. So natramur means aggravation in the morning time. That we have to remember. And there is prolapse of the uterus, slipping down from its position, and back pain is there, and desire to support the back. And mental exertion causes worsening of the symptoms. Open air, cold bathing, lying on the right side, and putting pressure against the back can help in managing these symptoms. And the mind symptoms, which are characteristic in this remedy, is the psychic causes of disease, ill effects of grief, fright, anger, etc. And depressed, particularly in chronic disease, and the consolation aggravates. This is the characteristic symptom. Irritability is present and gets into passion about trifles and awkward, hasty, wants to be alone and wants to cry tears with laughter. So these are the symptoms which helps in the selection of Natramur, and it will help. And the next remedy is sepia. Sepia is a very wonderful remedy, and especially for a female patient, this will help. And the common name is inky juice of cuttlefish. Symptoms are sepia officinalis is one of the best known homeopathic remedies for treating disorders associated with the uterus. It is useful in the management of these symptoms like hot flushes at menopause. This will really help in the age group of 45 to 50 years, along with excessive sweating and weakness. And there is pain that extends down into the back. There is yellow greenish discharge through the vagina along with itching. There is too late, scanty and irregular menses, sharp, clutching pain during menses, nausea in the morning on an empty stomach, pain in the vaginal region, and there is prolapse of uterus and vagina. So mental symptoms are dreads to be alone, very sad, weeps and when telling symptoms. When she will be like when we are taking the case, she will be weeping. So that is the main characteristic symptom. Miserly, anxious towards evening and indolent. So these are the symptoms of sepia. The next remedy is the most common, which is very helpful. That is Calcarea carb. The common name is carbonate of lime. The symptom, the remedy is useful in the individuals with the following symptoms, like problems due to impaired nutrition, swelling in various glands, a jaded mental or physical state due to overwork, and there is old sprains and swelling of the joints, and there is pain in the lower back and fat accumulation in the abdomen. And the female patient complains of white discharge, abdominal pain, feeling cold and headache before periods. This is the characteristic symptom. And there is burning sensation and itchiness in the groin before and after menses. There is tenderness and swelling of breast before menses. So these are the characteristic symptoms. Excessive sweating in the external genital region and toothache and vertigo during periods. So this is the characteristic, toothache and vertigo during periods. Menses are early and prolonged with excessive bleeding, cold and clammy feet, and complaints get worse in the cold weather. And the mental symptoms are the patient is apprehensive, worse towards evening. The complaints aggravate. Fears, loss of reason, misfortune, confused, low-spirited, anxiety and palpitation is present, obstinacy and slight mental effort produces to do work and exertion. So these are the symptoms of Calcarea carb. The next remedy is lachesis, as our today's cases of lachesis only. The common name is bushmaster or suruku snake poison. The symptoms here is inflammation of breast with a bluish discoloration, and the remedy particularly using at the beginning and end of the menses. It is suitable for women who have the symptoms like pain and swelling, hardness in the left ovary, pain in the lowest portion of the back, particularly while getting up from the seated position, a tendency to bleed easily, inability to bear the pressure of tight clothing, especially around the neck. Scanty periods are seen, waves of pain in the head and vertigo, which are relieved by starting of menses. And the mind symptoms are loquacity, as we have seen in our case. Made you sad in the morning, no desire to mix with the world, restless and uneasy, does not wish to attend to any business, wants to be off somewhere all the time, jealousy is seen, and labor best performed at night, euthanasia suspicious, insanity, derangement of the time sense. So these are the symptoms of lachesis, which will help in our day-to-day clinical practice. The next is lycopodium. even this is very helpful. Like the common name is club moss. The symptoms, the patient who benefit from this remedy are typically older, having complaints in the right ovary, and experience the following symptoms like delayed menses with profuse bleeding that lasts for a longer time. White discharge is seen, leukorrhea is seen, and burning sensation in the vagina, and there is pain in the right ovarian region, blood discharge from the vagina while passing stools. And there is distension and bloated abdomen, diarrhea, pain in the lower back, excessive urination, especially during the night. Disturbance in in the liver function, with the fluid collection in the abdomen and sensitivity of the liver. There is increased appetite, complaints worse in the evening between 4 and 8 p.m. Warm food and drinks make the throat and stomach feel better. And the mental generals which we often see is there is melancholy, afraid to be alone, little things annoy, extremely sensitive, averse to undertaking new things, headstrong and haughty when sick, loss of self-confidence, hurried, and there is a breaking down under stress, and apprehensive, weak memory, confused thought, and there is sadness in the morning on waking. So these are the symptoms of lycopodium. And the next remedy, see, I have only like the next remedy is Bryonia alba, which is often seen like in our day-to-day clinical practice. The common name is wild hops. Symptoms is Bryonia alba is mainly useful in managing stitching and tearing pain in any muscle. It is beneficial in individuals with the following symptoms, like early periods and there is profuse bleeding, irregular periods with symptoms associated with stomach and tearing pain in the legs, which worsens with motion, stitching pain in the ovarian region while breathing, in severe pain in the right ovary as if torn. This pain extends to the thigh and the breast pain during periods, hot and painful, hard breast. So these are the characteristic symptoms of bryonia. So there is a pain between periods with soreness in the pelvis and abdomen. There is frequent bleeding of the nose just before periods, pain in the back region, mainly due to change in the weather, and the mental generals are exceedingly irritable. Everything puts him or her out of humor. So there is delirium is seen in this patient, wants to go home and talks about the business in the home. So these are the characteristic symptoms of Bryonia alba. And the next and the last remedy is the most common, as we have seen, is the pulsatilla. Pulsatilla, the common name is windflower. Windflower is primarily a female remedy, useful in women who are mild, gentle, and yielding in nature. They have some of the following signs and symptoms like absence of period. As we are in our day-to-day practice, absence of periods or missing periods is generally due to wetting of it. Pulsatilla will really help. There is scanty or late periods. Bleeding during menses is generally clotted, thick, and varies between menses. And there is chilliness present in the patient. There is nausea and pain during menses, and pressure in the pubic region and downwards. Shooting pain in the back region, especially while sitting. There is loose motion during and after menses. There is creamy white discharge from the vagina along with burning sensation, and there is lack of thirst and dryness of mouth is present. The patient seeks open air. The patient wants open air and feels better on going out in the open. Fatty meals may worsen these symptoms and should hence be avoided. The mental generals are the patient weeps easily, timid and irresolute, fears in the evening to be alone, dark and ghost like sympathy. And children like fuss and cases, easily discouraged, morbid dread of the opposite sex, religious melancholy, given to extremes of pleasure and pain, highly emotional, mentally, and April day. So these are the symptoms of the pulsatilla, wonderful remedy. So these are the symptoms, and the next last is with PCOD, diet and lifestyle management is very important. So along with the medicine, what we can advise them for the irregular menses is, see, you can see the image. They have to take the wheat, grain, green leafy vegetables, and apples as it contains vitamins, and grapes, and the milk, orange juice, beans, spinach, and peas, broccoli is advised. And the lifestyle is they have to now, as many are working in MSc and career oriented, night shift they'll be working, and we have to advise them like because of the small things, their lifestyle is changed. They have to take proper 8 hours of sleep, and morning they have to get up and they have to do regular exercise for at least 30 minutes. And walking, sedentary life has to be we have to advise them they have to take walking, cycling, and not depend on vehicles or lifts and all. So the proper fitness exercise is very important, and every 6 months or 3 months they have to get checkup for any thyroid and any menses problems. So they have to go to take the checkup. So these are advised to the patient. So this is about the homeopathic treatment of PCOD. Thank you so much.
Yes, thank you, Dr. Shalini. It's a nice presentation, and I think it's the first presentation, the maiden presentation IFPH. So it's
Yes,
time
sir.
for discussion. Those who would like to participate can go to the participant list and raise your hand. And Dr. Ramadevi Ambadi is the first person to raise hand. Madam, please, you can unmute now. Yeah. Dr. Ramadevi Ambadi, please unmute.
Can you hear? Can you hear?
Yes, yes, please.
See, please, will you or anybody explain the meaning of April Day of Pulsatilla?
Okay. Actually, in the book it's given it's April Day. Maybe the symptoms in that patient, maybe in the month of April the symptoms are aggravated, and when maybe in that April month when this medicine is given, maybe it will help. Maybe.
Not fully explained, because if it is aggravated in any other month, we have to take May month, May Day or June Day. Some other explanation is there. If anybody else can tell, please tell.
I think the changeability, that may be the reason.
Pardon?
Changeability of symptoms or changeability of the weather, that may be the reason.
Why the month April is mentioned?
April is the cruelest month. You just asked to T.S. Eliot. Where is April? T.S. Eliot in a poetry, the wasteland. Where is it? April is the cruelest month. So you can have some explanation from those.
Flowering season, Pulsatilla flowering season in April. Is it correct?
Maybe. Only those who are expert in English he may be able to explain all these things.
If he or anybody can explain, I have one doubt. That's it. I have asked several persons. Each person were explaining different manner. That's why I asked.
Yes, of course, we need a Shakespeare to explain the exact English term. Otherwise, at least a Shashi Tharoor may be needed. Yes. Now, Dr. Veena Ganesh, please unmute. Yes. Dr. Veena, you can unmute now. Please unmute.
Sir, I think it is because of the flowering season of Pulsatilla, probably. And as you said, there is a change of weather. So in both ways, it is indicated.
Yes. There are chances. Now, who is this 1 plus? It is better to rename yourself. Otherwise, it's very difficult for us to identify you. Who is this 1 plus? Please unmute and ask. Yes, 1 plus. Please.
Hello.
Yes, louder, please.
Hello.
Yes.
Good evening, sir.
Louder, please. You are not audible.
I think so. April is because as a patient is in changeability and confusion mind, exactly what to do and what to not do, or emotionally sensitive. That's why, as in April, May, we used to explain this April month as for exactly in foolish mind or exactly in too much sensitive mood. That's why the patient is in sensitive mood. That's so I can, so we can use April words for that.
Yes, okay. Now there question of Shalini in the chat box. Which potency is best for amenorrhea? Is a question.
So the potency is, as I have mentioned, it's 1 stat 200 potency.
Okay.
200 potency.
If anybody is there would like to participate or to ask something to our honorable guest, this is a new participant in the IFPH, and then how will you differentiate between this PCOS and PCOD? Yes, Dr. Shalini.
Yes, sir. Sir, as I have showed the slide in the PCOS is rare and it is irreversible, and PCOD with the treatment it can be reversed. PCOS mainly is along with the polycystic ovarian disease, there will be diabetic and hypertension and other conditions will be there. In PCOD, it will be mainly of polycystic ovarian disease. So this becomes syndrome and this becomes a disease of ovary only. So that is the main differentiating point.
Okay. Now, Dr. Veena, you can unmute now. Yes, Dr. Veena.
Actually, it's given like this Pulsatilla nigricans. It blooms only in spring during Easter. And they used to color the Easter eggs with the Pulsatilla flower. So probably that is the reason it is given so.
Yes, definitely. Dr. Ramadevi Ambadi, please.
I forgot to tell one thing. Shalini, you had explained this PCOS subject very nicely. Very nice presentation. Keep it up.
Okay, ma'am. Thank you so much. Thank you.
Then what are the investigations? How we can, how to conduct an investigation? What are the investigations needed in these cases of PCOS as well as PCOD?
Sir, when any patient comes to us like complaints of irregular menses, the first we have to advise them is the USG abdomen scanning. We have to advise them, and we have to advise for thyroid profile also. So for PCOD, the main investigating point is the USG abdomen scanning. We have to advise them. Along with that, thyroid profile test also we have to advise them.
Okay. Then what about the other PCOS?
So syndrome and disease for both abdomen scanning is only advised.
What about the hormonal assay, hormone studies, the estrogen, the progesterone?
Sir, yeah, in case of infertility, we have to advise them hormonal assay.
Okay. Now, Dr. Hubert, yes.
Hello, doctor. It was a very nice presentation. Can you hear me?
Yes, yes.
Can you hear me? Okay. Doctor, it was a very nice and very simple presentation you made. I am very happy to see you. Doctor, I want to ask you whether in such conditions, if PCOD cases, there's intermenstrual bleeding, drop by drop bleeding throughout the month, what we can do?
Okay. Sir, we have to take the case thoroughly, sir. Like we have to find out like intermediate spotting is seen in the patient. We have to take the case properly, and abdomen scanning and thyroid profile test has to be done. And based on that, the treatment, like we have to find out the characteristic remedy. peculiar peculiar symptoms. We have to find out the peculiar individual characteristic symptom in that patient, which helps in finding out the correct individual constitutional remedy for us, and it will help in that patient.
I ask you whether why this dropping of blood throughout the month? Is it any reason?
Spotting reason.
Yeah.
Yes.
Not much bleeding.
Sir, a reason we have to find out, like as I told, abdomen scanning, we have to do like any fibroids are there, or any PCOD is there, or any endometrial cancer, like we have to find out. So through abdomen scanning and through thyroid profile test, like any thyroid is there, like hypothyroidism or hyperthyroidism. On investigation only we can find out the reason.
I am not talking about it, but why this is only dropping for throughout the month? If it is not a big bleeding, it is a profuse bleeding, but very scanty, but 1 or 2 drops for the throughout the month. That is why the reason I am asking you.
For the reason for spotting.
Yeah. It is not much blood, only a drop, 2 drops.
Okay. Sir, we have to find out the through investigation only we can find out.
Okay, thank you.
Okay. Then Dr. Surya is there. Dr. Surya, you can unmute now.
Doctor, I have doubt what you are telling. PCOS is going to change into cancer of uterus, or PCOD is going to change into uterus, cancer of uterus?
See, PCOS, polycystic ovarian syndrome, it is a syndrome, and if it left untreated, it may cause endometrial cancer.
Endometrial cancer. Okay, but PCOD and PCOS symptoms are almost same, no? In PCOD, they cannot, the fertility of the woman won't affect, but it will not affect. But in PCOS, the fertility will affect. Is it the difference?
See, in the PCOS, it is a syndrome along with polycystic ovarian disease. Many other diseases like diabetes or hypertension or any other complaints will be there.
But not a must, no? Not a must, no?
A syndrome means it is a syndrome.
No, syndrome means a collection of symptoms. Is it, madam? Doctor?
Syndrome is along with polycystic ovarian disease, the other diseases are present, like diabetes mellitus, whether it is.
Okay, is it a must? Other diseases are is seen as a must or not?
Syndrome is, it is a must. Other diseases also present.
Oh yeah, okay. Thank you. Thank you, doctor.
Yes.
Then you have mentioned about a few medicines, polygraph medicines that are very useful. First one is sepia, then the next one is natrum, epis, natrum or sepia. Well, all these medicines are there, and they are more substantial rather than the so-called acute, the partially proved medicines, or going through behind some clues and other things. What is more substantial is always depends upon the old conventional, the well-proved medicines, the constitutional medicine, the deep acting medicine. That is the most important thing. Because otherwise what will happen is that often the patient will get a palliation. In the coming years, what will happen, nobody knows. But when you prescribe these medicines, it will give a comprehensive cure, not a recovery. That is most important. Moreover, the presence of the miasm must be recognized and should be addressed. As said by H.A. Roberts, the infantile colics are always of psychotic origin. So when a girl child comes with this infantile colic, the physician must have such a view that the coming year it will likely to develop all these things. Then another thing is that meat, animal proteins always, or meat always activate this psychotic miasm. So that's also an important thing. Now, Dr. Hariharan, sir, please. Yes, you can unmute now, sir.
Okay,
Yes,
Doctor, Doctor, I like to congratulate you, Doctor. Your simple explanation regarding what's PCOD and the collection of symptoms of PCOS. I think PCOS is the premonitory symptom of PCOD. One who travels through the PCOS, finally, the patient will have come to PCOD and all other symptoms, what you said. And PCOS is very dangerous than PCOD. I think it's so.
Yeah.
See, another thing I like to say, your explanation regarding certain medicines very, very correct. For that, I am congratulating. Because but first you said lachesis. Lachesis is a hot patient, you said, and the tightening of cloth, dislike the lightening of cloth, dislike the tightness of cloth, lachesis. Thus, you said certain symptoms and you proved that lachesis cured that case. Very good. Very, very good. Another thing is, you see, natramo. You said very, 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 that is a constitutional medicine, natramo. Then sepia, it is a wonderful remedy for PCOD, wonderful remedy for PSA. See, another medicine you said, calcarea carb. See, calcarea carb is the main remedy for PCOD. And that patient's constitutional symptoms are very, one remedy you have forgot. What is that? That is graphitis. You said you not said about graphitis.
Yes.
Then another is lycopodium. What the symptom? What the symptoms you said about lycopodium is very, very correct. But certain mental symptoms you have omitted. One is cowardice. That is very, very important regarding see lycopodium. Lycopodium is a hot patient. Or what other symptoms you said. So I am congratulating you. I am see certain other remedies also have. See pulsatilla, that is a wonderful remedy for PCOD. Very, 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 very easily we can cure if a pulsatilla patient come to our chamber. Within no time we can prescribe the pulsatilla. That the changeability, that hot patient, a lot of symptoms, very, very predominating symptoms regarding pulsatilla. So, dear doctor, I am congratulating you for your very nice class. Come again, come again, come again. Okay, thank you.
Thank you
Yes,
so
that was Dr. Hariharan, one of the senior most person on this IFPH platform, and he was very keen and listening all these things and making notes and reference in between. That's most important thing. Now, Dr. Veena, please unmute.
I just came back to give a clarification here. See,
Yes.
regarding PCOS, there is no ovulation at times. So when there is irregular ovulation or no ovulation, then the commonest symptoms will be amenorrhea. And when it go, and since there is amenorrhea and ovulation, there will be endometrial thickness, and the shedding or the growth of the endometrium, preparing the bed for the ovum, cannot happen in a normal fashion like other women, because there is PCOS. So hence there will be shedding of endometrium irregularly. So there can be menorrhagia, metorrhagia, spotting, and also amenorrhea in case of PCOS. This is scientific explanation for the hormonal imbalance which leads to anovulatory cycles, and that is why the cycle is irregular. That is why they get these commonest symptoms, and this commonest symptoms may vary between individuals. A person may get amenorrhea, other person may get metorrhagia, another one may get spotting. Accordingly, we can categorize them and select the medicine according to homeopathic principles. So I think the presentation will be individualistic, but the commonest symptoms are amenorrhea, metrorrhagia, menorrhagia, spotting, anything may be there, or in each period it may differ, it may be like that. So hope this clarifies that question.
Yes, exactly. This is what Dr. Hubert was asking, and he did contented with this your answer, Dr. Veena. Nice presentation, nice response. That is what we are expecting. Then other thing is that the reference textbooks is making a big difference. I think in these days, not the classical works or the master's works we are not following. Which is the textbook now following in your college days, Dr. Shalini? Yes.
Yeah.
Which is the textbook you followed for the references in preparing these things? Yes.
Sir, repertory is Pathak repertory, Boric repertory.
No, I am not asking about repertory, but the other thing, the gynecological part.
Gynecological part, like Datta for the Datta for the gynecological books, and for Materia Medica, like the obviously which we find is Kent Materia Medica, and repertory is Boric and Pathak.
Yes, but in fact, the classical what we have studied at that time is the Shas textbook of gynecology. I think that is also still in using in different colleges, but unfortunately, what is the latest trend is that even nobody is studying the Bailey and Love surgery. They use some other medicines, some other books, just like the medicine also, not working, not following the Harrison textbook of medicine. In fact, some local lads prepare some compilation work, and unfortunately, these brilliant and intelligent persons wasting ambitiously wasting their time by following all these texts, so that they will not get enough idea regarding the clinical medicine. That's what happens. They have to blindly follow the technicalities, that means laboratory investigations. That's I think a great threat for the medical profession, I think. Dr. Shalini, what is your opinion?
Sir, yeah, the books which are available, like when we were in our UG BHMS, those books are very helpful, and what our assistant professor advised, those books are very helpful, and those books are only enough for our practice, like how many years of experience we have also. Those books are like very good in understanding, like if we are reading again and again for many years, it will become a habit for us, and easy to find out the constitutional remedy or the regarding miasms or anything. So these are the books which I'll advise my juniors or anyone to study. So we have to like read these books.
Yes, more reading is needed, more reflection is needed. That's all what needed. Now, Dr. Hariharan sir, please express a lot of thanks to our Dr. Shalini, who is made for first presentation IFPH. Dr. Hariharan sir, please.
Okay, okay, doctor. Your class is very nice. We are very much obliged to you for your class. Okay, thank you very much. Come again with another subject. Okay, good night.
Thank you so much. Thank you so much for IFPH for giving me an opportunity. Thank you so much for everyone. Thank you.
Well, that marks the end of today's session. The timing of this IFPH is the most important thing, I think, because we should start at exact time, because everybody has got their own engagements, their own schedules. But if a session goes beyond the time schedule, it will be total difficulty for all those participating in the program. That's why we are strictly following a time schedule. It's not to disturb or to demoralize anyone. Those who all participate must understand the difficulty of this moderator, especially for the who are continually working for these days. This is why I mentioned this. There is a comment from the earlier session that we did interfere with their time. That's because of their lack of information regarding the IFPs. That may be the reason of the comment. With that, let me conclude today's session and hope you to be the same tomorrow. Till then, goodbye, and over Dr. Hubert De Silva to continue the program in Malayalam.